All right, you can be seated for now. Good evening. I know you're out there. I can hear you breathing. Good evening. Welcome. I'm Dr. Jim Coble. I'm the Dean of the College of Dental Medicine. And I want to welcome you all to the very first white coat ceremony in honor of the very first class of students in the very first College of Dental Medicine in northern New England. And that is the last time anyone will be able to say that. So welcome. Before I turn my attention to the newest members of our dental profession, I want to thank some other important people for being here. We have some special guests from throughout the university, some members of the local dental community seated in the first row behind our students. Welcome. We thank you all for being here. I want to especially thank the parents, the grandparents, the aunts, the uncles, the mothers and fathers, the children, and all the other family members who are here, not only for attending tonight, but for all you've done, all we know you've done to help these young men and women reach this point in their lives. Thank you. I want to thank our dedicated faculty and staff. It's their enthusiasm, their knowledge, and their skill that provide the opportunity for our students to learn. And finally, thank you to our students. We truly are appreciative that you chose UNE for your dental education. But now, as I've told you before, as you begin your professional careers, there's another person that's even more important than you are, and that's the patient. Dentistry clearly has three major characteristics of a profession. Education beyond the usual level. You're probably thinking right now way beyond the usual level, right? The right to self-government and the primary duty of service to the public. And that's where the patients come in. Patients are your family members, your friends, your neighbors, your colleagues. We all want the people we care for to be cared for in turn by competent healthcare providers. And you will be those competent, caring healthcare providers. People debate about the future of healthcare and the future of dentistry. What's the practice of dentistry going to be like 10 or 20 or 30 years from now? And I would say to you, don't worry about that, because we're not here to prepare you for a particular future. We're here to prepare you for whatever your future holds. You'll learn how to access information, how to analyze and evaluate that information based on science, how to acquire, develop, and perfect your clinical skills, and how to put all that together to meet a particular patient's oral health care needs. As a former Surgeon General of the United States has repeatedly said, when we all know this, you cannot have good overall health without good oral health. There is ongoing research related to the possible links between periodontal disease and cardiovascular disease. A pregnant woman with periodontal disease may have significantly increased chances of delivering a preterm, low birth weight baby. Saliva as a diagnostic tool can be as useful as blood or urine, and researchers have reported early success using saliva to detect some forms of cancer. As you know by now, you've chosen one of the most rigorous educational programs there is. It's a lot of hard work, and every once in a while it can be a little bit stressful, right? Would you agree with that? No. They're still smiling. This is a good sign. But there's a good reason that it's hard and that it's stressful, if you think about it. In 4 short years, actually less than 4 years, we have to take you from being rookies to being competent, caring, beginning oral health care professionals. That's a lot to do in a short period of time. So take advantage of every opportunity to learn everything you can. The more you learn, the more skills you master, the more clinical experiences you have, the better prepared you're going to be to treat your individual patients. And as you'll hear many times, your education is just the beginning. It doesn't end at graduation. which actually will come to you a whole lot sooner than you think right now. So dedicate yourselves to continuing that process of learning and developing new skills from now just until forever. After forever, you can slow down if you'd like. That's part of being a professional. As you enter the profession, you're going to benefit. You already have benefited from those who've gone before you. In turn, as professionals, you have obligation to make contributions that will benefit the public and those people who will follow you. As the pioneer class, you have a key role to play in the future of our college, a big responsibility. And as faculty, we're going to hold you to the highest expectations, but we also know you have the ability to meet those expectations. So respect each other. Know that the very best oral health care is delivered by a competent, caring team of providers. Appreciate that each member of the team has knowledge and skill that can be brought to bear in the service of patients. Value that knowledge and skill. Don't be threatened by it. And in the end, your obligation, it's not really to me or to the faculty or to your families or even to yourselves. Your real obligation is to the thousands of patients you will help throughout your professional careers. Patients, people, will trust you to help them be healthier, look better, and feel better. And that's the significance of these white coats you're about to receive, a reminder of your responsibility to each and every patient you treat. They will trust that you will listen to them, that you have the knowledge and skill to diagnose and treat their individual health care needs. There is no greater honor than to have another human being entrust himself or herself to your care. You are and will continue to be worthy of that honor. And all of us are very, very proud to have you as new members of our great profession. Thank you very, very much. Now it says Dr. Coble will introduce Dr. Rippich. When I do this, I like to share some behind-the-scenes knowledge of how we plan these events. Working here at UNE, I'm reminded actually very often by a quote of St. Francis of Assisi, who said, "Start by doing what's necessary, then do what's possible, and suddenly you are doing the impossible." This university spends a good deal of time looking into the future to identify what is necessary. In recent years, this visionary thinking has resulted in doing what to many seemed impossible. This spring, we graduated our first class of pharmacists. This fall, we welcomed our first class of future dental professionals and dedicated our new oral health center. And in January, we will welcome our first class of undergraduate students to our fantastic new campus in Morocco. So from spring to January, that's not too bad. I wonder what we'll do next spring. This impossible dream of a dental school began as early as 2005. At that time, an initial feasibility study focused on the development of dental residencies. Our president, who dreams no small dreams, came on board, looked into the future, and saw that more than a residency program would be needed to meet the oral health care needs of Maine and northern New England. She extended the study, directed that it be focused on the establishment of a new dental school, which at that time was a pretty bold move, I can tell you. In 2008, the UNE Board of Trustees approved the academic plan, and in 2010, the board formally approved the establishment of a dental school. Our president is an individual whose dedication, enthusiasm, and vision have helped make UNE such a special place. She has that unique quality that inspires each of us to accomplish more than seems possible every day. By her example, she reminds us to honor our past, to remain fully engaged in the present, and to always keep our eyes on the future as we continue to help our students turn their dreams into reality and to build the University of New England into one of the great global universities of the world. As she continues in her 8th year as president of the University of New England, please join me in welcoming Dr. Danielle Rippich.
was wonderful hearing that story told again, because as I welcome everyone here tonight, I can remember how this all began. It was in my first months in Maine, people kept coming up to me and saying, will the University of New England start a dental school? And I realized that at that time, this was the largest geographic area in the U.S. without a college of dental medicine. And so that need was there. I think the support and the desire of the dentists, of the public in Maine, everybody really knew that this was something that needed to happen, and we took on that responsibility, as the university often does, of trying to meet that need. I often say we're a private university with a very public mission, and I think this College of Dental Medicine is probably the perfect exemplar of that and how seriously we take our responsibilities. This is an exciting and a proud evening for me, I can tell you, and I think for everybody here on the stage. It has been a journey. Martin Luther King, who visited our campus in Biddeford 50 years ago in 1964, just before he went back to Washington to have the civil rights legislation, that landmark bill, passed. He came to, the only time he ever came to Maine, and he spoke. He said, take your first step in faith. You don't have to see the whole staircase, but just take the first step. It's interesting, I've been reading about him on this sort of upcoming 50th anniversary, and I think about that in the way that we've built this college. In many ways, this was not only a first step, it was a leap of faith. And years ago, in this discussion, I don't think could have imagined the wonderful, wonderful college that Dean Coble and the faculty here have created. It is the most innovative curriculum in the country, as well as honoring the past, as Dean Coble said. This is really a reality now, and I think we are joining you in this first step on your next staircase as you take this journey in your career. You are pioneers, and you're charged with a very special vocation. The university interviewed and had applicants for over 1,200 individuals, and of those, you have been selected. You are special, you are one of a kind, and you were chosen because of your unique gifts and talents and the potential that each of you have. You have, as a class and as individuals, secured a permanent place in the history of your college and of the university. When we dedicated the Oral Health Center and the college on October 2nd, that evening at a dinner, the class of 2017 presented Dean Coble and me with a beautiful etched glass, sort of a plaque that it was interesting. Each of the students had signed by etching their name with their dental tools into it. It was very touching to receive that. I have to tell you, I was told you practiced on some other glass before because these were beautiful. They're really nice. And I'm thinking, I haven't told Dean Coble this, but I think we should have you sign the windows in the new Oral Health Center before you leave. I think we need to have your names there. I have to tell you, that gift, it really took my breath away. He's like worried. Oh, James. He's like, no. No, I really love this, as you can tell. It was such a special gift, and as I said, the etching of your names into that glass, you really etched a place in my heart as well, and I think at the heart of the university. And I think as Dean Coble said, the countless lives that you will touch in your careers will also have the benefit of each of you and your unique gifts. So I don't want you to forget the reason you're here. As Dean Coble said, it is about the patients, but I think as you recite your oath of dentistry, you'll be reminded of this obligation to be compassionate, humble, and treat your patient as a whole person. And when you do so, I think you will appreciate the joy of healing, and that really transcends any other benefits, I believe, that you can have. This is, as I said, your first step in the staircase, and I ask you not to be afraid of that. We are all here, family, friends, loved ones, faculty, ready to join you and support you in every step of this journey. And you have a beautiful path laid before you by Dean Coble as our founding dean. This is the third college that he's led, so we know that he has that experience, and he also has a wonderful faculty that's joining him. I want to thank you for inviting me to share this very special evening with you and celebrate this very symbolic moment in your careers as dentists. Thank you.
Yeah, that night at dinner, when our mutual friend Dr. Sandell snuck up on us and presented us with those glass sculptures, I guess I would call them, it probably was one of the very few times you're going to see a dean and a president with tears in their eyes. It was very, very touching, and we continue to be touched. And the other thing that's come up with that is I was talking to Dr. Vachon, and we're going to have a glass carving competency in the course, since you all did so well. It's my pleasure, my true pleasure now to introduce really a good friend, Dr. Joe Connealy. You can read in the program all of the great things that Joe has done. Most recently, he was elected the international president-elect of the International College of Dentists, which is the oldest and largest international honorary dental organization. And that's significant right now because I did forget to mention that this ceremony is not only being videotaped, it's being broadcast live over the internet around the world. So when you come up here to get your coat, look good, okay, like you always do. You never know who's going to be watching. I decided to take a different tack in addressing Dr. Connealy. I went on to his dental office website to learn a little bit more about his other life outside of his professional organizations. And it really struck me that the website, the message that Dr. Connealy has on his website, signifies all of the things that we think are important in being a professional person. It was really neat to read this. And I'm going to share some of this with you as part of my introduction. There's a quote: "In the 30-plus years I have been a dentist," and he's only 27, so I don't know how that works. "In the 30-plus years I've been a dentist, I've had the privilege of serving several generations of families. I have seen those I have cared for grow up, go through life-changing events, and accomplish many great things. They are wonderful people, and many have become close friends." That really summarizes, I think, in a few words, what a dental practice is all about. As Joe goes on to say, "There's always something new and interesting developing in my field, and being a geek at heart, I'm usually an early adopter of new technologies." He talks about the team. I mentioned the team. "Each member of our team puts our patients first, provides superior customer care. I hire smart people with positive personalities, invest time and money in their training, empower them to be creative thinkers, and utilize their talents." If you just remember that one statement, you've learned all you need to know about running a successful dental practice. "We learn a lot from each other," he goes on to say. "My team members are adventurous, fun-loving, and know how to work with the many different personalities of our patients. People laugh a lot here. Every team member is quick to flash her bright smile, and several know how to make pretty good balloon animals for the kids." Joe talks about his continuing education, the courses he takes, another part of being a professional. He talks about his many activities in professional associations, not because it's something he has to do, but because it's something he believes is important to do as a professional person. And that's taken him not only around the country, but throughout the world. He talks about family. One of the members of Dr. Joe's family is here with us today, the lovely Dr. Lisa Howard, who is an orthodontist. and a great person in her own right. You know, I was thinking about Lisa and Joe today as I was reading through this, and I realized that we both met our spouses, Joe, at about the same time, I think. So there are some other parallels in our lives. And as I would normally say, we both married up, right, Lisa? Is that a fair statement? Joe's leisure interests include computers, boating, kayaking, ice hockey, downhill skiing, cycling, watercolor painting, politics, cooking, wine, collecting, travel, learning languages, hiking, art collecting, music, and golf. He's a big fan of the Red Sox and Bruins, New York Giants, and New England Patriots. And finally, he says he's always tried to serve his community by contributing my energies in a meaningful way. To that end, I found working with young people to be inspiring and enjoyable. He's done a lot of coaching of hockey and Little League and soccer. And he's sponsored softball team. One's called the Shamrocks. He has a youth hockey team named the Drillers and a Little League baseball team known as the Choppers. Do you sense a theme there in those team names? It's my great, great pleasure to introduce to you my great friend and colleague, Dr. Joe Connealy.
Good evening. You don't have to answer back. I'm not a dental dean. I didn't realize that Dean Coble was actually going to deliver my speech for me this evening, but I'll try to excerpt out some of it. It is truly my honor and sincere pleasure to be able to welcome the inaugural class of the University of New England College of Dental Medicine to the initial clinical phase of its training. I also bring the greetings of the Board of Regents of the International College of Dentists, who invite you to live by the ICD core values of integrity, leadership, and service. Voltaire once said, "Those who are occupied in the restoration of health to others by the joint exertion of skill and humanity are above all the great of the earth. They even partake of divinity, since to preserve and renew is almost as noble as to create." In dentistry, although only the oral surgeons and certain dental deans have taken Voltaire's divinity concept literally, I think he's on the right track. A dentist is engaged in a wonderful profession. Maintaining someone's health or attempting to restore a diseased, traumatized, disfigured, or disabled patient to a healthy state is indeed a divine endeavor. Dentistry is a noble and time-honored profession. You're entering the profession that pioneered prevention as its hallmark and sets the standard in that field to this very day. You're joining the profession that introduced anesthesia to the world, ending centuries of needless suffering at the hands of healers. You're becoming a member of the profession that has been an innovative leader in healthcare policy. In fact, 40 years ago, last week, the American Dental Association became the first nationwide organization or company to adopt a ban on smoking in its buildings and its meetings. That would have been 1973. In dentistry, you'll have the regular opportunity to create art while always keeping in mind the science that allows that art to endure. You'll have the opportunity to become a part of the fabric of the lives of many families, watching children grow up in 6-month intervals like time-lapse photography. And if you've created good relationships along the way, you'll get to treat the children of those children too. But let's talk about you. Most of you appear to be approximately the ages of my own children. So I've read a lot about your generation, mostly out of self-defense. As a group, you tend to expect meaningful and challenging work. And I'm sure even at this early stage of your career and development, you've probably gotten a glimpse of how true that's going to be. Dentistry demands a lot of attention to detail. As you progress toward mastery, you will eventually make it look easy. Try to remember how hard it was at first. Your generation values opportunities for learning and advancement. Dentistry will provide those in abundance. Keep in mind that no matter how much knowledge your excellent faculty crams into your cranium over the next 4 years, a 4-year DMD degree is only the entry level to a lifetime of learning. How you advance as a dentist is up to you. I've been doing this for over 30 years, and I have skills today that I didn't have a year ago. I fully expect to have skills a year from now that I don't have today. Welcome to lifelong learning. Your millennial generation values a balance between life and work. You'll have control of that only if you own or purchase your own practice. Just remember that if you end up working for a baby boomer like me, that dentist believes that the key to his or her success was a willingness to stay late sometimes or come in after hours for a patient in need. Professionalism sometimes requires self-sacrifice. Your true friends will understand when you're delayed, and your children will be fine being fed by your spouse or mother from time to time. On the positive side, millennials value fair treatment and competitive pay. Dentistry will provide you with that. So after over 30 years, please allow me to share the insights of my early experiences. My first dean at Tufts, Dr. Robert Shira, was a retired two-star general who was in charge of the military dental corps during the Vietnam War. On our first day of class, he marched us into the largest auditorium at school, gave us our orders, but one thing he said stayed with me. He said, "I know that this is an expensive school, and I know that most of you are worried about your debt. But let me promise you this, if you keep the best interests of the person in your chair first and foremost at all times, you won't have to worry about feeding your family or paying off your loans." I offer Dean Shira's advice to you. It still rings true today. I wasn't a gifted dental student. I was a solid dental student, and there's a big difference. I struggled with the make-or-break preclinical preparation for a gold onlay, which probably is not taught anymore. Is it? Okay. Well, a passing grade on the practical exam for this procedure would allow a tough student of that era to go into the clinical phase. We then had to complete 6 more of them as part of our graduation requirements. The first gold onlay that I completed in clinic was placed in the mouth of my wife at the time, who was a business major in college. I was really on my game that morning, and after skillfully removing the enormous amalgam that had been there, I completed the finest preparation of my dental career. Every line angle was sharp as a razor. The shoulder was 1.5 millimeters all around, and the bevel was perfectly sloped 1 millimeter. I proudly held up the hand mirror to show off my masterpiece, and my wife burst into tears. She said, "What did you do to my tooth?" The insight I received from this incident is never show your patients the preparations. In your heart, you know that you've completed a sculpture in dentin and enamel of Rodin-like quality. The person who you've done that for will probably think of you more as the guy in the blood-stained white smock behind the meat counter at Shaw's. Go ahead, celebrate on the inside, high-five your dental assistant if you must, but never show a patient the preparations. In my senior year, I was performing a periodontal surgical procedure with my junior partner assisting. Now, this man is currently a fine dentist, past president of his state dental society, but at this point in his budding career, he allowed the sentence, "Wow, look at that sucker bleed," to pass from his lips. Of course, the patient's eyes bugged out of his head, and it took me a bit of talking to get him to lie back down in the chair and finish. The advice I offer from this is to be careful what you say in clinical areas. Patients can hear really well. In the years before simulators, dental students learned preclinical operative dentistry on something called a dentiform, which was a metal and plastic simulation of a mouth that had the ivorine teeth that I hear you still use today. On these, we practiced our tooth preparations and our fillings. Of course, this was done without water spray in the preclinic, producing a fine coating of dust, which we're supposed to blow off with a bulb-like instrument called a chip blower. These didn't work very well, and most of us just would do this. These were also the days before masks and gloves were worn in dentistry for anything besides a surgical procedure. And a classmate of mine was treating his first clinical patient. Eyeing the debris that was preventing a good view of the preparation, he leaned in and did this in the patient's mouth. Needless to say, the patient was less than thrilled. The moral of this tale is to remember that there are some things in life that cannot be simulated. My externship site was a state-run facility, now the site of a wonderful organic farm called the Pineland Center. The Pineland Center, in the days before group homes and mainstreaming, was a campus which housed developmentally disabled people with moderate to severe mental handicaps. Maine native students at Tufts were assigned to Maine sites, and this site was my choice by virtue of a short straw, rather than by the goodness of my heart. That said, I took the assignment very seriously and studied all of the syndromes associated with mental retardation, including some of the physical abnormalities that I might encounter, such as polymegaly, extra fingers, acromegaly, etc. I was not prepared for the woman in my chair who exhibited 4 breasts. So I called the program director over and said, I've read all the literature on mental retardation and the syndromes, and I don't remember anything about supernumerary breasts. He looked down at the patient and said, oh, Alice, put your bra on right. Alice's preferred position was generally about 8 inches higher than reality, but the insight I received from that were 2, actually. One is, don't disregard the obvious diagnosis, and the other is never underestimate your own capacity for stupidity. My last story happened in my first year as a practicing dentist, working in the practice of an older dentist. In this practice, new patients were charted, x-rayed, and initially examined by the hygienist, and then the dentist followed with a brief examination. The new patient that I was to see had severe periodontal disease, so much so that her teeth had lost quite a bit of bone support and some were quite loose. As she spoke to me, I could see large, dark areas of decay in some of her front teeth. I began discussing whether she would be more interested in pursuing a course of trying to save some of the teeth with aggressive periodontal treatment and a fairly substantial reconstruction afterward, or if she was more interested in extractions and dentures. She said, oh no, I'm here because you just bleached my niece Monica's teeth and they look great. I was wondering if you could do that for me. So my advice is, always meet your new patient first. Be the first one to talk to them. Sit eye to eye, look them in the eye, and ask a question like, what brought you here today? What can I do for you? Seek first to understand, then to be understood, as Stephen Covey said. It'll save a lot of time and embarrassment in the long run. Finally, I urge you to be a good colleague to your classmates and later to your fellow dentists. Offer your knowledge and insights freely. Collaborate. Help when you're asked to help. As Al Gore once said, if you want to go quickly, go alone. If you want to go far, go together. Enjoy your night.
Thank you, Joe. I have to tell you, well, 2 things. One, if ever I'm on the same program, I always want to go before Dr. Connealy because he is a hard act to follow. Secondly, one of those stories you told has left an image in my brain that it's going to take me a long time to get out. Thank you very much. And I won't tell you which story that was. Now I'm going to ask Dr. John Ryder, Dr. Joan Sandell, and Dr. Lionel Pete Vachon to assume their posts. I'm assuming you know where your posts are. And this is why we're here tonight. This is the time where we present our young men and women, our new professionals with their white coats, symbolizing their entry into the profession of dentistry. I'm going to turn the podium over to Dr. Ryder.
Can I have the first line of students please go to your left to receive your coats? Shiloh Annis. Courtney Baker. Just for Baugh. Michelle Berry. Emily Burns. Dorothy Lynn Cataldo. Brian Cicero. Kelsey Cohn. Rachel Kreischer. Ridthi Daftari. Jordan Dunn. William Fenn. Rebecca Phelan. Jacob Philibrown. Karis Flynn. Lauren Gallant. Isha Gandhi. Frank Gassler. Amber Jelinas. Mallory Godin. Vidushi Gupta. Tyler Hancock. Benjamin Higgins. Katie Jo Hunt. Tan Hun. Ina Ivanova. Robert Jarris. Jessica Joseph. Alex Kerbaugh. Lydia Kwasnik. Adam L'Italian. Are we? Amy Landry. Kyle Limatainen. Ava Lindert. Mitchell Mamorsky. Christina McCann. Trevor McCullough. Jennifer Miedema. Jawad Mirzai. Brett Morgan. Amanda Munger. Dustin Nadeau. Douglas Narker. Christina Norby. Russell O'Connell. Okay, Dr. Vachon, let's move along. Nathan O'Neill. Susie O. Topher Pochabit. Shafat Rabi. Make sure his hair is okay, Dr. Vachon. Enrico Ross. Jonathan Snyder. Julia Servetnik. How come you take longer with some and not others, Dr. Vachon? Joshua Sivany. Ray Thomas. Jackson Threet. Chelsea Toussaint. An Tran. Sherry Valley. David Velick. Jack Verplug. Cha Vu. Nicholas Wentworth. Bradford Wenzel. Kenneth Youth.
So before we go any further, please join me in giving a rousing welcome to the We forgot to remind Dr. Vachon that you have class on Monday morning, and we need to get you there in time. He did get into that, though. That you got to say that. Thank you all. Thank you all. You know, sometimes during an event like this, you want to just stop and remain silent and soak it in, because this is really a significant moment for each and every one of us. I know it is for all of our young professionals here, but for everybody in the room and for all of those who love you and care for you who couldn't be here tonight, this is a great moment. So congratulations once again. We now have Dr. Ryder coming back up to lead you in the Dentist Pledge, so pay close attention to Dr. Ryder.
Okay, I'm going to read the pledge, one line at a time, and I'd like you to repeat it after me. And when I say, I state your name, please don't say state your name. State your own name. Please stand. I state your name. As a member of the dental profession, shall keep this pledge and these stipulations. I understand and accept that my primary responsibility is to my patients, and I shall dedicate myself to render, to the best of my ability, the highest standard of oral health care, and to maintain a relationship of respect and confidence. Therefore, let all come to me safe in the knowledge that their total health and well-being are my first consideration, I shall accept the responsibility that as a professional, my competence rests on continuing the attainment of knowledge and skill in the arts and sciences of dentistry. I acknowledge my obligation to support and sustain the honor and integrity of the profession, and to conduct myself in all endeavors such that I shall merit the respect of patients, colleagues, and my community. I further commit myself to the betterment of my community for the benefit of all society. I shall faithfully observe the principles of ethics. It's almost finished. And the code of professional conduct set forth by the profession. All this I pledge with pride in my commitment to the profession and to the public it serves. Thank you. You can.
We're at the end. I do want to thank some folks. I want to thank the staff of the Holiday Inn. They did a great job this evening turning this room around for us and getting it all set up for you. I want to thank our musical performers, Flights of Fancy. This is your first inaugural white coat ceremony, isn't it, I bet? Yes. Thank you. Well, this is the inaugural one. The last one wasn't the inaugural one. Come on. And I want to, in particular, thank the staff of UNE and the College of Dental Medicine who have worked so hard to bring all this together for us. Wherever you are in the room, if you're still in the room, would all of the staff, both from the college and from the university, please stand up and be recognized? And our faithful photographer, Jeff. Thank you, Jeff. And our producer, director, videographer, Dave Dadiego. Thanks, David. We would love to have you join us for a reception down in the lower level. If you go out the rear doors here, around to the right and down the stairs, the students, I'm sure, will be happy to show you. And please join us, and I hope to have the chance to meet each and every one of you this evening. We'd ask that our guests please remain seated until we've led the students out of the auditorium. Thank you once again for being here.